Welcome back with your Eye on Health. It's time for the doctor segment every Wednesday with Dr. Sudip Bose, Medical Center Hospital. Doctor, thanks so much for joining us today. Let's talk about this guy, this scary looking guy. Huge. If you see one of these, run,
it might eat you. I mean, this is half the size of us.
Right. Why should we stay away from these guys, or what's the danger? Especially this time of year, we're hearing a lot about mosquitoes.
Well, I think the thing that gets a lot of hype in the news is West Nile virus, but the main thing with mosquitoes is they're just a pest, or they're a nuisance, and they're a bother. And most patients who are bitten by mosquitoes do not end up having West Nile virus. And if you have West Nile virus, most patients don't end up even having symptoms. So just getting bitten by a mosquito is not a reason in and of itself to panic, unless the mosquito is this big and it bites your head off. Then you have a problem. Right?
But let's talk about the symptoms. If you do come down with some kind of the West Nile virus, what are the symptoms to be on the lookout for?
So I think the main point I'd make here is you don't need to go to your doctor for a mosquito bite unless you're sick. And you're going to know when you have bad symptoms of West Nile virus. Really bad headache, a stiff neck, really high fevers. And that's something you'll probably end up going to the doctor for anyways, whether you know you have a mosquito bite or not. So, if you get bitten by a mosquito, you're probably going to be okay. And a lot of times, we might have had a minor version of the West Nile virus and we thought it was the flu and it just went away. That's normally what happens.
Who are those people? Most of us don't really have to worry about this, but there are some people who need to be a little bit more cautious when it comes to mosquitoes. Who are those people that need to worry a little bit?
So I'd say everybody should be cautious and use prevention. And we'll talk about some of those prevention techniques. But people with weaker immune systems from disease or the extremes of age, extremely old, extremely young, when your immune system isn't as strong, they might be a little more susceptible. But remember, if you end up getting bitten by a mosquito, 1 out of 150 will probably have any symptoms of West Nile virus. So you're going to be okay most of the time, so don't panic.
But if you do have some of those symptoms, it's important to go get checked out because it can be fatal in some cases, and we've experienced that here in West Texas.
Right. There are rare cases where they are fatal, and it's usually in people with weaker immune systems. And in those cases, you're going to know something is wrong, whether you know you had a mosquito bite or not. So I'd say go to your doctor if you're sick, practice prevention techniques, empty out puddles of water in your yard, whether it's baby pools or flower pots. Use bug spray. Cover your skin with long sleeves when it's dawn or dusk, and use bug spray.
Right. All right. Well, always great tips for us. And
stay
of course,
healthy.
Don't panic too much, though, unless he's this big. So you have nothing to worry about. All right, Dr. Sudip Bose, thank you so much for joining us today.
Thank you.
And if you have any questions relating to health or medical issues, you can email me at the email at the bottom of your screen, or Guaderrama at cbs7.com, or you can go on the Facebook page there and submit your question there. We'll be right back. Stay with us.